Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Avenue, and I've seen the commercials about Inspire and wondered what is Inspire. So I thought I'd just follow up with something I'd promised before, giving you a little update on how Inspire works. And it's a treatment for obstructive sleep apnea, which stimulates the accessory muscles that help you breathe, and the hypoglossal nerve that uh, uh, keeps the tongue from obstructing your airway. And it's just, in many ways, it's like a respiratory pacemaker. You know, you have a pacemaker they put in the heart to keep your heart beating. Well, this is a pacemaker they put in your neck to help you breathe and also to eliminate respiratory obstruction. But it requires surgery. You have to have this implanted device which monitors breathing and delivers impulses to the hypoglossal nerve, which is the nerve that causes the tongue to move. And it requires anesthesia to some extent, whether it's local or general. And you have a small incision in your neck or chest. And the stimulator is then placed near the collarbone. A lead is attached to the hypoglossal nerve, the nerve that controls the tongue, and a breathing sensor that monitors your respiratory pattern and changes it. The surgeon tests the device while in surgery to make sure that it works and that the tongue is activated when you press the button. 70 to 80% of the patients who have this surgery have a significant improvement, and 1/3 have full control of sleep. However, it should be remembered that CPAP is the gold standard. But if for some reason you can't use CPAP, Inspire is something as a good alternative for those who do not like the CPAP. So any comments or questions about that you'd ask me about Inspire? So I thought I'd educate you about it and see if you had any additional questions.
What's the cost, Doc?
It's just like any other surgery. You know, you have to ask your surgeon what it's going to cost because it varies from place to place.
So with you saying that CPAP is the gold standard, does that mean CPAP works better than the Inspire?
That's what that means, yes.
Okay.
And it's an alternative to those who cannot use CPAP and who qualify for it after an evaluation by their surgeon. And it works very much like the heart pacemaker that people have whose heart isn't working well. They have a pacemaker put in so their heart can beat well. So this monitors your breathing and also helps you to breathe and overcome the obstructive sleep apnea. Any other questions or comments about Inspire?
Not about that. It just seems like every day with the TV media, they put out different kinds of medication like this Inspire. And I don't know if it's to educate the public.
Remember, it's not a medication.
Okay.
It's an operation.
Okay.
It's a stimulator that's put into your neck that helps you, monitors your breathing and also stimulates your tongue so it does not obstruct your breathing. So it's not a medication. It's really a surgical procedure, very similar to the pacemaker that people get when their heart stops beating.
Okay. I guess it's good to educate the public and let us know what else is out there. And maybe these are some of the things some of the doctors don't explain to us as, you know, this is one of the options for sleep apnea or something like that.
Any other comments or questions about Inspire?
My question is, sleep apnea, is that a permanent condition or is that something that could go away with age or something?
In general, it's permanent unless whatever you have, if you have adenoids and you have surgery, you can remove it. Or if you have uh, anything that's obstructing you that they could treat, uh, that's maybe temporary. But for most people, it's a chronic condition that requires CPAP or something else in order for you to have a normal oxygen level as you sleep. Because what happens is when you're sleeping, you stop breathing and your oxygen level goes low, and you don't recover from it because you have acidosis and other metabolic issues that develop that cause you to have high blood pressure and many other problems. And so it is thought to contribute to the mortality for Black people because it's more common among Blacks than it is among other ethnic groups. Any other comments or questions about obstructive sleep apnea and CPAP versus Inspire? If not, I just thought I'd follow that up because I promised to do that. And, John, you can start the plethora of articles that you have.
Dr. Callender, I have one more. There's this other commercial, and I think it's just something commercial it's called Luna. It's something where you put deodorant all over your body. Is that excessive? Because a white just take a shower bath, but they have this deodorant and they're programming, like for a while they were saying even deodorant with certain chemicals that you're adding to your body is almost other countries, France or some other countries, they don't wear deodorant at all. But in America, yeah, we do under the arms, but they got feet, hands, wherever they think there might be, not hands, but wherever they think there might be a body odor, they want you to put this stuff all over your body. What do you think about that?
Nothing.
Oh, okay.
Yeah.
Nothing. Yeah.
I think it's a money issue. Someone's come up with an idea to make money.
Right. Yeah.
Mm-hmm.
What about deodorant? What about deodorant, period? I know what we Americans say, but there are other countries. Do they have this? Does deodorant present any health issues?
It depends on what deodorants you use, but most of them are, as long as you apply them gently, don't cause too many trouble. But some deodorants have toxins in them, so you have to be careful. And you have to read what they say. Daria, any comments about the deodorant issue? Because that's not something I'm aware of. The toxins in everything, but there was a interesting article about relating hair straighteners to kidney disease recently that came out, but haven't read much about deodorants.
Yeah, I've listened to the commercial too, and I really never researched it, but um, I'm always kind of reluctant to apply something over your entire body that could block pores. And
Right. Yeah.
They're
Okay.
they're even coming out now with petroleum jelly. That women should never put that on their face and etc. And what harm that is causing us to put even, Vaseline on your body or face, then that is blocking pores and it's causing certain problems. They're coming out with more and more. At first, we thought even, Baby Johnson powder wouldn't cause any harm, and they're finding more things, even with some lotions that you shouldn't put on your body. So,
Absolutely. Yeah.
I think before we go, I've heard, and I don't know if this is true, that certain deodorants contain aluminum, and the aluminum compounds may be toxic in some way if they get inside.
I don't know. I haven't read anything about that, so I couldn't make any comment.
Yeah, I've read some research that the aluminum compounds can be toxic, and most of the time, you do have options in buying aluminum-free deodorant. That's what I buy.
Okay, this is an article that talks about the Change Health cyber attack, which on the face of it may not seem as anything that is a concern, but it actually involves some $15 billion, and it affects people of color more than others. And so it's important to understand that these cyber attacks do impact our healthcare, and of course, there's not much you can do about it, but uh, it's something that does impact us. And as when they knock out a service like this that has 15 billion interactions, that affects a lot of people who are poor people, and that also affects the doctors who may or may not get paid. And so it's something to alert you to the problems associated with being hacked and other things like that. It's unlikely they're going to hack you because you don't have that kind of money, but this is a concern, and that's why some people protect their identity at all costs, and they hate to use emails or social media because of the concerns about people taking away their identity. So just to notice that this is the article that talks about uh, healthcare to the nation's poor. That's us, and how United Health, which is one of the biggest providers of healthcare, is it serves more than 30 million poor and uninsured patients, and so this impacts us to a great extent. So you may not think that it affects us, but it does to a great extent. Fortunately, many of us have not felt the impact of this, but especially those of us who are unemployed or are retired and are on Medicare, this may have some impact. And in some instances, they actually are providing funds to the physicians as well as trying to make sure that the patients are serviced in spite of this hacking and cybersecurity risk.
Dr. Callender, do you think that now with so many records being put online, that helps to people able to infiltrate the system?
Absolutely. Most of the records now are online, and so when they invalidate the healthcare system, they've blocked all of your records, and so it becomes a big issue. And especially if you don't have cash on hand, then you you don't no longer have the ability to pay your bills and all those things. So it's uh, it's a whale of an issue that impacts all of us eventually, whether we know it or not.
And Dr. Callender, these criminals that are doing this, it's all about money. They're trying to get money. They're
And
they're
they usually get money.
they're holding these institutions hostage to get money.
Right,
It's
right,
I'm
right.
just wondering what is being done internationally to to stop this, or
There's a
maybe.
lot being tried, but a lot of it is coming out of China and Russia and other countries. So So they're working on it. When they hacked Howard University, the FBI and others became very much involved in it. But apparently Howard never forked up the money and found ways to overcome it.
Okay.
Okay, let's go to the next one. This is an article that frightening because we know that medical mistakes harm more than as the third leading cause of injury and death in the United States. But the fact that many of these mistakes harm people of color is something that is well known. And there are many instances in which people of color have been wrong, so to speak, misdiagnosed and many other things. And you see some other evidence of this in some of the other articles. And it's true that misdiagnosis and other accidents occur in the hospital, and the fact that they involve us to a great extent is something that we have to be concerned about. And that's why whenever you are sick and you're being treated and you're not getting better, it becomes important to get a second opinion. Because we all know that we have the highest mortality rate among developed countries, without question, and that our moms are more likely to die as a consequence of maternal mortality. And this relates to everything, not only heart disease, but just everything. And you read articles later on about the gender disparities. But it's well known that the errors and mistakes that are made particularly involve us, and therefore it's important if we're not satisfied with the treatment we're getting, it's important to get a second or third opinion.
Dr. Callender, I have a question. The Food and Drug Administration control whether drugs can go on the market or whether they're in the experimental stage. Is that the same thing for procedures and surgeries? Are some surgeries and procedures experimental and controlled by the FDA?
No, surgery is not controlled by the FDA, but insurers will not pay for experimental surgery. They will pay for surgery that's accepted and approved, but not by FDA, but that is approved. But if it's experimental, insurers generally will not pay for experimental surgery. So it's the insurers who decide whether they consider it experimental or not.
I had a question, Doc. This statement at the top that Black children were a lot less likely to be correctly diagnosed with appendicitis. What would go into that? A bad diagnosis.
Well, there are many causes of abdominal pain. And so, particularly in female children, there's differential diagnosis of salpingitis, tubular ovarian abscess, and other gender issues. So for women, there may be differential diagnosis that would result in somebody missing a diagnosis of appendicitis. In males, it's less common to have those kind of mistakes, although they still occur. Whenever you have diagnosis to be made, people can make mistakes. And so I hope that answers your question. So abdominal pain can be caused by so many different things. One of the things is appendicitis. So making that diagnosis sometimes depends upon interpretation of x-rays and sometimes just by physical examination. But anytime you have a diagnosis to be made, it can be mistaken.
I'm reading an article from the AAMC.org, and I'm not sure what that is. But the title of the article is "Do Black Patients Fare Better with Black Doctors?" And let's see, it says, can we say that that you, a Black patient, have a Black doctor, you're going to have better health outcomes? Yes, we can, because the evidence shows that Black doctors provide better care for Black patients.
That is demonstrated time and time again. Right. Any other questions about this? And it's the reality. So I think the best way to handle it is if you have a situation and you're not getting better, then you need to get a second opinion. And as he's suggesting, having a Black doctor can be helpful if you're Black. So do that. What you want is a doctor who listens to you, who cares for you, regardless of his or her complexion.
So
Dr.
Doc,
Callender.
I found 2 articles in the news about this. So, but go ahead. You're trying to ask a question.
Yeah, this is good morning, everybody. This is Sylvia. I was just trying to think, I guess for misdiagnosis and a patient passes, I was just thinking in terms of options for, I guess, family is to sue. And if they do, is there a large number of cases that may be pending regarding misdiagnosis and the loss of a family member where a family may be coming through trying to, sue?
Very common. It's very common. Yeah.
Mm.
Very common. The most common way to avoid malpractice suits is to have a good relationship between the family and the doctor, and keep the family and the physician intertwined at every stage. And there's evidence to show that whether the doctor makes a mistake or not, the likelihood of suit is lessened if there's a good interaction between the family and the physician.
Yeah.
Doctors are human, and doctors make mistakes, so that does occur. And when it does occur, very often families sue.
Yeah, I worked all my life in insurance, and medical malpractice was a part of that. And typically, the thought was that medical malpractice cases are difficult to prove, not impossible, but it needs to be shown that the negligence of the medical provider is in question is actually caused harm to the patient, and sometimes it's difficult to prove because the people are already sick, and you need medical expert testimony corroboration as far as the negligence of the doctor, and sometimes it's difficult to get doctors to conclusively testify about negligence of another doctor. So difficult to prove, not impossible.
Well, many doctors, because of the money involved, will testify against another doctor. So that's become less of an issue. This is any other questions about that before we go on to the next
Dr.
case?
Callender, you just said that they would not testify against another doctor. Is that what you said?
No, I said they will.
Oh, they will. Okay.
Because they're financial incentives, which will allow many doctors to testify against another doctor.
Mm.
So it's not uncommon anymore. They just raise the price, and the doctors can be found.
But you know, Dr. Callender, I find that in other fields too. Policing. One police officer shot somebody in cold blood, and now the unions come in and the other partner comes in, and it's a question of whether to testify against him or not. In the same way with teachers. Teachers say, yeah, I saw him beat the kid, you know, and the other teacher said, no, I didn't see that, you know, that kind of thing. So it's a brotherhood thing going in there too.
But money talks and sometimes overcomes the brotherhood. Okay, this is another case of misdiagnosis. Now, of course, with cervical cancer, the Pap smear is part of the diagnosis, that so that every woman who has a vaginal or issue should have a Pap smear. But sometimes that doesn't happen. And this lady had problems and they didn't do a Pap smear. And turns out that she had cervical cancer, which is something that should not happen because we mentioned HPV is a virus that causes cervical cancer. And with the vaccine, this should eliminate cervical cancer. But for those who didn't have the vaccine and don't get Pap smears, and every woman should have one, this then is something that can happen. And this is what happened to this lady who had many interactions with doctors, but they didn't do a Pap smear. And she turned out to have cervical cancer. And this is unfortunately is not rare. And so this is why when you have an issue and you're not satisfied, you get a second opinion so you can get somebody to do the right thing. And I think this is, go back to the other slide, please. Go back to the previous slide. Yeah.
I'm sorry, I just closed the article. I have to.
Oh, okay. All right. But anyway, so that, the Pap smear, there's an article, as John Tatum talked, there was an article in the Washington Post this Tuesday about the Pap smear, which is what every woman needs to have. And it's the state of the art. So for a woman to have a vaginal concern, vaginal bleeding, and not have a Pap smear is kind of it is malpractice, and it's something that should not occur. But it has occurred and will occur again. It's another example of misdiagnosis. Any questions about that, the Pap smear and the cervical cancer in the HPV association?
One thing I think we said in the group session is that after a certain age, a woman would not have to have.
After 65, right. You don't need it after 65, but most of the people who die from cervical cancer are actually young women who are in their 30s, 20s. One of my nurses, her brother's wife died from cervical cancer. She was in her 30s. Okay, this is another sad case in which we talk about maternal mortality, and the United States leads the developed countries in maternal mortality. This is a situation where the mother and the child die. I'm a result of when my twin brother and I were born, our mother died within 48 hours of our birth. And so we understand the tragedy of maternal mortality more than many others. But this is something that is difficult. The best way of trying to avoid this is to have the mother to be evaluated as early as possible after the diagnosis of pregnancy to try to identify the causes of bleeding after delivery, and also the cause of infection. And so this usually is helped by having people go to the doctor after they've been diagnosed with pregnancy and monitored so that early signs of infection can be picked up and they can be treated and cured. And this article again points out what Darrell commented, that the data suggests that Black patients are treated better by Black doctors. Any comment about this? This is one of the saddest aspects of the practice of medicine in the United States, is that although we're one of the richest countries in the world, we have among the developed countries, we have the highest maternal mortality rate.
My question is, what is this, some kind of a syndrome, or does it have some kind of specific cause?
Yeah, there are specific causes, yes. Bleeding after, we have placenta previa, which is a situation in which bleeding can occur after you deliver. You have a placenta trichia, where you have the placenta sticking and not being leaving the uterus and getting infected, and so there are diseases that are associated with it. Hemorrhage is probably one of the biggest problems, but infection is a problem, but is easily managed by the appropriate antibiotics, and also having hypertension and eclampsia and other things. But most of those can be handled by having the mother to have care by the obstetrician shortly after they find they're pregnant, and they're monitored so that they can avoid some of these problems. So that's the answer, is to have the mother shortly after pregnancy to be followed by obstetrician so they can identify early on any potential complications and treat them.
Are there any thought that mothers are discharged too soon from the hospital after delivery?
Well, most of the problems occur in the hospital, so it's usually not that they're not discharged. They're usually, many of them that die in the hospital. But I don't know any data that indicates that they're discharged early. I do know that many of them die in the hospital. Any other comments or questions? It's something that is embarrassing, should be embarrassing to all Americans, that people of color have such high maternal mortality rates.
Dr. Callender, I noticed, you know, back when I was having children, or even my children were having children, they kept you in the hospital longer, and actually for different surgeries, not just childbirth, than they do today. Is it because the process has gotten better, or what's your take on why they let you out so much sooner now after an operation?
Well, they realize that most of the patients do not have to stay in the hospital. And if you have no complications, then it is shown that people can be discharged without consequence. But the most of the mortalities that occur with the maternal mortalities actually occur in the hospital. Hemorrhage is one of the biggest problems. Infection would be a later one, and which would lend itself to the possibility of being prematurely discharged. Because if you have no complications, then discharge within the next 24 to 48 hours is reasonable. On the other hand, if you have complications, then you would need to stay in the house to have the complications managed.
Yeah. I was one of the lucky ones in that you mentioned the term placenta previa. I had that, but I had it before delivery, my 8th month, and went to the hospital. And once they got it under control, within that week, they said to deliver a healthy child, I would have to remain in the hospital for a month or until delivery, which at that point I felt well. They had me up walking. So they didn't want to send me home because my husband worked and I would have been there by myself. I went to Mama's, and it was like dropping me off at daycare. He dropped me off Sunday night. I stayed at my mom's all week, picked me up Friday, and he was coming over in the evenings. And we did that 3 or 4 weeks, and I did have a healthy child, but I did have placenta previa, where the placenta, I guess, Dr. Callender separates, and they were able to stop it, contain it, and it worked out well.
Right, because it's one of the situations where if it's not managed properly, you can bleed to death.
Yeah.
Right, and then placenta accretia is a situation where the placenta actually does not separate, and you can get infections, and that is a consequence. Any other questions about that? Because women of color are more likely to die and be associated with maternal mortalities than other women. This is an article that talks about because of manipulation, can a stroke be caused by cervical manipulation? The answer is yes, although it's rare. But because people treat headaches with cervical manipulation, this question came up, and you can see that although it is not common, it does occur, and actually, this article points out that it's not usually the carotid that is the problem; it's the vertebral artery that is more often associated with the bleeding in the brain or stroke in the brain after cervical manipulation. So I don't know, any of you have manipulations for headache? But this would apply to those people who have cervical manipulations for headache.
I had a question, Dr. Callender. What is that cervical manipulation? What I always thought
That's
that
a
was
treatment for headache. Some people, the chiropractors, for example, may have cervical manipulation in order to treat headaches. And it is a concern that in manipulating the head in the treatment for headaches, that they can interfere with the circulation to the brain. And this is one of the weaknesses of the study. It didn't analyze vertebral artery dissections, which can occur with cervical manipulations. And so this still remains an issue.
I don't know why I was thinking that it was the cervix. That's
a term for the neck.
Oh, okay.
Thank you, John. Thank you for
Yes,
that. That's,
yes, cervix.
sounds stupid.
Yeah, cervix. Yeah. That's okay. So when they talk about cervical manipulation, they're talking about manipulation of the neck
Okay, thank you. Thank
as a treatment for headache.
Yeah, I was wondering. I wasn't able to put two and two together that time.
Yeah, the cervix is, of course, the neck of the uterus. See, so that's the cervix, but the neck is the neck. So people manipulate the neck. That's what they're
Okay,
talking about, manipulating the neck.
now I understand. Thank you.
Yeah, thank you, John.
A lot of people have the same misunderstanding. So thank you for bringing it up. So often we physicians may use terms that we take for granted that nobody else understands, and it's important that you, if you have a question, to bring it up. Yeah, and that's why headache,
Yeah,
because
that's why I put the article right after the other ones. I thought it was related. Uh, yeah,
no, it's the neck. It's the neck.
how about that?
But yeah, but many people go to chiropractors and they do all kinds of manipulations of body parts. And for headache, this is one of the treatments for it.
Say, John, can you imagine a woman going to the doctor for a headache and she asks me, "Well, what are you doing down there?" "I have a headache."
Well, that would be inappropriate because
Definitely.
headache is the neck, not the uh, pelvis. Okay. Next, thank you for clarifying that, though. This is the first time that a pig kidney has been transplanted to a living patient. The previous transplants were to deceased brain dead patients. And so this is where CRISPR gene edited pig, where the antibodies that previously caused hyperacute rejection were removed, performed this on a 62-year-old man. And he elected to have this procedure. It is hoped that this will be successful because it may be the beginning of a new era of xenotransplantation, which is transplantation of organs from other species. The question, of course, is would you want your life to be saved by a pig's kidney or a human kidney or any other kidney? And so this is a giant step forward. Now you recall we had two xenotransplants hearts, and both of those patients died within a month. So this will be very exciting to see what happens because it is, as is mentioned, 17 people die every day because of the shortage of donors, and there's 100,000 people waiting for transplants. About close to 90,000 of people are waiting for kidneys. So this would be something. Dr. Williams is a nephrologist of color at the Mass General, who is the associate chief of the dialysis unit there, and so
So I
Would this
had
be considered an experimental surgery that insurance may not
yes,
cover?
yes, this is definitely experimental surgery.
I had two questions, Doc. So the the kidney is genetically manipulated. Okay, so does that start from the birth of the pig, or when does the genetic manipulation occur? And are they, because of that, are they concerned that the natural immune response of that pig kidney might go away or redevelop after a while in the human?
Well, what happens is that these pigs are treated so that they do not have, in other words, CRISPR-Cas9, which we talked about some time ago, the antibodies are deleted from the pigs, and the pigs then grow up without having the antibodies or the antigens, rather, that cause the hyperacute rejection. They also are genetically treated so that they don't have the porcine endogenous retrovirus, which is a virus that is found in pigs. So you have genetically modified pig kidneys that are not antigenic to humans and do not have the porcine endogenous retrovirus. So those are the two things that are done in these kidneys that are created and genetically modified so that you don't have rejection. So so time will tell. This is the first that is done, so we will see. The hope is that this will be the first of many and will be successful. It's been a while since we were doing xenotransplants because of HIV. Our efforts at doing xenotransplants with the with the with the monkey and ape model were stopped, and so this now is a return to xenotransplantation, in which the genes are eliminated from the pig, and they are then transplanted with the expectation that they will not be rejected and will not be the source of infection. The number one problem in transplantation is the shortage of donors.
And the gentleman is doing good so far?
So far. So far, so good.
And when you say that the fact that the problem is that we don't have donors, I would really be remiss if I didn't say something about your phenomenal work on making sure that Black people donate their organs. And we all, the globe has to thank you, Dr. Callender, for your work, your tireless work. I've seen you through the decades encouraging us. And I am an organ donor because of you, and everybody that I know that I can influence is because of your work. And so I applaud you.
Thank you for the applaud. Thank you very much. Okay. All right. But I must admit that it is unlikely we will ever have enough human organs to be able to keep 17 people from dying every single day. And so these xenotransplants may be part of the answer. There's also stem cell transplantation will be, and the regeneration of organs will help as well. But it's apparent to me that we're not going to be able to get enough human organs to stem the tide and keep 17 people from dying every single day because of the shortage of donors.
What's the process for taking this out of the xenotransplants to take it from experimental to standard approved surgery? Is it that the patients live for a certain amount of time and the success rate is that just the success rate just determined by how long the patients lived after transplantation?
Yes, well, there are two things. One is that they survive the operation. Number two is that they don't give other humans an infection that the pig had. And so those are the two concerns. So yes, the patient survival, graft survival, and not transmitting any infection from the pig to humans. Those are the three concerns. And I would say that it would take about probably about a year or so before they would be able to say it's gone from experimental to non-experimental surgery, because if it's experimental, insurance will not pay for it. And with kidney transplantation, it took a while before it was no longer considered experimental. But as you said, it has to do with patient survival, graft survival, and the fact that the person who receives the pig kidney does not transmit any infection from the pig to the human.
Yeah, but because it is experimental and insurance isn't paying for it, it's going to be a small number of surgeries because it's going to be out of pocket or somebody's going to have to donate the surgical services.
Correct. Correct. But we're hopeful that this is the beginning of something that will turn out to be no longer experimental after a while. Any other comments or questions? If not, we'll go to the next one.
Yeah, I think this is part of the problem where a lot of treatment is directed by insurance companies instead of physicians. As far as the payment, I think that's a problem with the American payment of medical services. That there's too much involvement by insurance companies.
Couldn't agree with you more. Any other comments or questions? If not, William Shatner, who is known for his acting, has stage 4 melanoma diagnosis. And it's true that when you get something like this, it changes everything about you. You learn that a lump on his right ear meant that he had metastatic melanoma, and your life is in jeopardy. We know that President Carter had his life saved because of immunotherapy that was done to him about 7 years ago. He had metastatic melanoma in his brain, and they gave him immunotherapy, which has prolonged his life. The tumor had gone away; it's come back again now, but immunotherapy saved President Carter's life and is saving his life as well. So that we've come a long way. And in the past, without the immunotherapy, he would probably be dead by now. So this is an advance of immunotherapy. So we're seeing a lot of advances that with time, while we're not as good as we want to be, we still have made a lot of positive changes. And now, for example, he is alive, and his tumor is resolving as a consequence of the immunotherapy, based upon the pioneering Nobel Prize winning work of scientists from Japan and California.
I have a question,
And I
Dr.
guess
Brown. So I go pretty much annually to a dermatologist. Being a diver, I'm out in the sun, and a fisherman, I'm out in the sun a lot. And fishermen and divers get direct sunlight as well as reflected sunlight. And I found a spot on my leg, and I was concerned about it, and the doctor said, no, there's nothing to it. I'm I'm really concerned about it. I don't know if I should be overly concerned, but I pay attention to my skin because melanoma is skin cancer, right?
Correct. Yeah, it's the most malignant of the cancer. Squamous cell cancer is the common skin cancer, but melanoma is the one that is associated with the greatest lethality. Uh, but the dermatologist is able to look at those lesions and do biopsies and determine whether it's uh, a tumor of old age, because as you get older, you get a lot of moles. Uh, and so they're able to differentiate by doing biopsies and by looking at them and deciding whether it's squamous cell cancer or squamous or just a skin lesion that is occurs. Because as you get older, you develop pigmented moles. You develop some aging uh, uh, changes in your skin, and so it's a good idea to have the dermatologist look at it, and then if there's any question about it, take a biopsy to find out. Now, in this case, that lump behind his neck was evidence of the spread of the disease to the lymph node.
I see. Hmm.
We also had one of our surgery residents had a melanoma in the scalp that the hairdresser identified. And of course, you know that Marley died of a melanoma in his toes. So
Wow.
Bob Marley died of a melanoma in his toes. So that in Black people, the tumors manifest themselves in unusual locations.
You
Sometimes,
know, you just brought up a critical point. If it's say the back of your head, you'll never see it, or in the back of your body. You know.
or if it's in your toes, you're likely not to see it. And actually, her hairdresser was doing her hair and noticed it, and that's how the diagnosis was made. But at that time, they didn't have this immunotherapy, so she died shortly thereafter. It's a tough disease. It's a disease for which we now have a treatment, which 10 years before we had no treatment for it, or didn't have a good treatment for it.
Dr. Callender, excuse me. I have quite a few moles around my neck, and I have one that I always thought was a beauty mark, but it's right above my eye. Should I be, because they've never bothered me, but does aging have anything to do with maybe becoming a problem?
Probably not, but I think it's good to have a dermatologist take a look at it. Those lesions, as long as they don't change, are not a concern. But if they change at all, then you have a dermatologist take a look at it. They stay the same, it's not a problem. But if they change in any way, or size or color, then dermatology evaluation becomes essential.
I have a similar problem. I have a lot of moles and they're under my breast. And I do go to a dermatologist once a year just so he can take a look and to help me understand how right now he's saying I shouldn't be concerned. He compared it to Morgan Freeman. If you notice his face, he has a lot of moles, and what you
Right,
have is similar to
right,
that. Yeah.
right. And as you age, you get more of them.
Yeah.
Right.
Mhm.
Okay, next one, please. Well, you know, it's interesting. The pandemic has done a lot of things for us that weren't so good. And one of the things with isolation has resulted in people drinking more alcohol. As a consequence, alcoholic liver disease is going back to taking its place as number one as the cause for uh, needing a liver transplant because it causes cirrhosis. And since we're drinking more than ever, this has been a problem. So hepatitis C, as you know, was the leading cause. And now that we've got a treatment for hepatitis C, alcoholic cirrhosis and non-alcoholic liver disease is becoming more and more common. And so that now alcoholic liver disease is the primary indication for liver transplantation, as well as the non-alcoholic liver disease. So this is something that is disturbing, but it's something that I believe that isolation has caused more people to be drinking more and more, and therefore you have these syndromes that are making liver cancer and liver transplantation more common. How many drinks should you have a day? Probably none, but no more than 1 to 2. I think 4 drinks in women and 5 drinks in men is awful. And there are too many people who actually are alcoholics, which means 1 drink is too much. So telling people you can have 4 or 5 drinks is unethical.
Dr. Callender, I heard that, tell me if I'm wrong, that alcohol is a carcinogen as well?
Yeah, well, it causes liver cancer. Yeah. Mhm. Yeah. It does many things that not so good for you.
Dr. Callender, when a person has alcohol-related liver disease, what is the how long do you have to be alcohol-free before they will do the transplant?
That's a good question. There was an article in the Washington Post last week that talked about the fact that it varies because some transplant centers, as long as you are in a program for treatment for your alcoholism, will transplant you as long as you are in a program. There's some programs that will not transplant you unless you've been free of alcohol for 6 months. But there are other programs. For example, here in DC, I think in Georgetown, they require 6 months. George Washington, they require you to be in a program, but they don't necessarily require you to have 6 months to be free of alcohol. So it depends. Transplant centers becoming more reasonable about it, and so if one of the things that you don't want to have is a person who has alcoholic liver disease to get a transplant and then start drinking again and have the disease recur, because one would think that you've wasted a liver. So the emphasis is on you stopping drinking. So if you're going to commit yourself to not drinking anymore, many centers now will transplant you, but there are still some centers who would require you to have a 6-month period of abstinence before they do a liver transplant on you.
And the other thing they probably consider is how sick you are.
Well, that's yeah, right. That's what I was saying, that if you're so sick that you would die within 6 months, they would transplant you under those circumstances before waiting for 6 months. At some centers, regardless, if you don't have 6 months, they're not going to transplant you.
Again, I would be remiss if I didn't state that a lot of these criteria have been changed to allow Black people to be considered for transplantation because of your work and your loud voice, Dr. Callender.
Thank you. Well,
it's important. It's important for everybody to know that. Okay. Because they refused transplantation for Black people because they had a history of considerations that you brought to transplantation boards are very important. And I don't know why I'm pushing this, but we have got to make sure that there are more Dr. Calendars, Clive calendars that are coming up. And because you've done amazing work for the globe, not just this country. And I'll be quiet.
Well, and I think the fact is that people are more sensitive to that now than they were when I first started out. In transplantation, it was a lot of discrimination. And I was a Lone Ranger for many years, pointing out that this discrimination needed to be changed. And it has over time. We're not where we need to be, but we've come a long way. And so I think I'm thrilled that my contribution has made a difference. Now we're back to this article, which is something we talked about last week, which is the fact that really the best treatment for uncontrolled hypertension is you taking control of your blood pressure and you managing it along with your physician and recognizing that you're at the center of the equation, not the doctor, but you. So there are many treatments for hypertension, but the biggest problem is that only 1 out of 4 people who have hypertension is actually controlled. So that means that 3 out of 4 are not controlled. And so as a consequence, the mortality for hypertensive cardiovascular disease has not changed. And so it becomes very important for us to recognize the role that we play. Because if you're on one medication for hypertension and it's not controlling it, and there's no point. If you're on 2 medications, it's not controlling, there's no point. What you have to be on enough medications so that your blood pressure is controlled. And lack of patient adherence is probably the #1 problem in control of hypertension. And it's not saying that all hypertension needs medication, because some hypertension needs diet change and diet restriction, salt restriction, and exercise and meditation. But it's important that we recognize that the center of the equation is you, and you working along with your doctor to keep your blood pressure controlled. And yes, there is cross talk between the brain and the kidney and other organs as well. But until we actually recognize that the patient is at the focal point of all of this, and that every patient who has hypertension should have a sphygmomanometer at home, so he or she can take his or her blood pressure on a daily or a weekly basis, so until the blood pressure is controlled. He's talking about renal denervation, and that's a special technique that they use, and it is thought that it helps the treatment of hypertension. But I'm usurping that and reminding you that most of the way to manage hypertension is you controlling your blood pressure by taking the medication, recording your blood pressures, and giving that information to the doctor so he can help you in your management of your hypertension. We talked about what should the blood pressure be, and it's clear to me that the blood pressure you should seek to have is 130/80 or lower, regardless of age, and that is something that we need to emphasize. Any comment or question about the fact that blood pressure control is something that global wide, this is the cardiovascular disease is the number one killer. Cancer is the number two killer. Any other comments about this? Let's go to the next article. This is an article that talks about a new inhalable lung treatment, which may be promising, but it's not here yet. It's something that you can inhale and will treat your cancer. One of the problems with most of the treatments that we have for cancer, especially lung cancer, it involves infusions of chemotherapy and other immune drugs that can be effective in the treatment of cancer. But the side effects are what are problematical, whether they're immunotherapy or chemotherapy. And so what this doctor has identified is a way of treating cancer by using an inhalable immunotherapy. This has not been FDA approved, so I don't want you to think that it's available now. It's something that is to let you know that they're working on it. And down the road, maybe in 2 or 3 years, they may have it worked out. But I just wanted you to know that they are actually working on inhalable lung treatments that will be effective against cancer. But they're not available yet. And this is not FDA approved, but it's something that you should know is in the works. I hesitated to include it, but I thought it was important that you should know it's in the work because down the road, it may become FDA approved.
A question on this topic, inhalable. That's interesting to me that, cigarettes and vaping and all these other kinds of things are harmful to your lungs, but yet they're working on something that you would take in the same way, but could down the road be helpful.
Yeah, that's why we'll put this article in because it makes sense, just as you mentioned, to do the opposite of what smoking and vaping does for your lungs. They toxic to the lungs, but this is something that will overcome perhaps that toxicity. Okay, let's go to the next one. We can. We talked something about this the last time, but what we didn't identify was that that this bacteria is found actually in the mouth, and this bacteria that causes dental plaque is the bacteria that renders colon cancer often untreatable, and so having the right antibiotics that knock out this bacterium will lead to having more cancers to be treatable. And this is the name of the bacterium that we talked about before. We just didn't appreciate the fact that it's usually found in the mouth and associated with periodontal disease, suggesting that keeping our mouth clean and free from bacteria is desirable. And this makes a target for treatment that you kill this bacteria and maybe your colon cancer is more likely to respond to chemotherapy and immunotherapy. That is now an important part of the treatment of colorectal cancer. Any comments on this? And sometimes with some of this, I wonder if we should include it, but the potential of prevention, taking care of your teeth and keeping your mouth clean, free of plaque, maybe an ounce of prevention is worth a pound of cure, and may forestall colorectal cancer.
My question, Doc, is that what about the dentists? Would they be able to take samples,
Well,
biopsy?
the dentist would be able to keep you from getting these plaques. And so if you see the dentist twice a year or every 6 months, then they would give you the techniques that would keep you free from dental plaques because the bacteria are found in the plaques. So in many ways, the answer to this is to make sure that you see your dentist once or twice a year. Let's go to the next one. I know we have so many. Now, this is a new test that may make it unnecessary for some people to have colonoscopy because this test, DNA blood test, would detect colorectal cancer in 90% of the cases. We really haven't had a blood test to do that. And so as this becomes FDA approved, this is something that may well help in people who are unable to have colonoscopy. We recognize that colonoscopy is the gold standard, but there are people who aren't healthy enough to have a colonoscopy. So we have to keep that in mind. That this could be a major advance for some of those people. So some people are thought to be too old, after you get over 80, and some people are thought too fragile to have a colonoscopy. So this would be a situation in which you do this blood test. If it's negative, then you might avoid colonoscopy. Okay, next slide, please.
On that, go ahead.
Yes,
Go ahead, John.
go ahead, John.
Gonna say that we've talked about a lot of cases where the blood tests you are used to detect certain diseases. And then we've also talked about cases where like for instance, prostate cancer, where other methods other than a blood test are better.
Well, I don't know about better, but we know that when this becomes FDA approved, this would be a test that would help in those patients who could not get a colonoscopy to have a diagnosis made, so that if it's negative, you may not need a colonoscopy. But I think that's the place for it right now. Are you suggesting that? I'm not sure. What are you suggesting by your question?
Oh yeah, my question. I was trying to relate it to the PSA and the digital exams.
Okay, PSA and digital exams are diagnostic of prostate cancer, and above certain levels, the PSA, and of course the digital examination is confirmatory. So if you do a rectal exam and you have a enlarged prostate and it's nodular, then that is highly suggestive of prostatic cancer, and therefore biopsy would confirm that. Still, the absolute gold standard is for you to have a biopsy confirmation of the cancer, whether it's the prostate or otherwise. So, so it doesn't replace the biopsy because that is the absolute gold standard for confirmation of a cancer. So these blood tests are suggestive and very helpful, but the pathological analysis of the specimen is where the absolute diagnosis of the cancer is made. Does that address your question or comment?
Yes, thank you. Yes, it does. Thank you.
That too was my question. If I was wondering if down the line, once this blood test was approved, would it eventually take the place of the colonoscopy altogether? But you just answered that.
Okay, all right. It's unlikely, but certainly for patients for whom you have concerns about whether they could withstand the colonoscopy, that's a test that you would use to decide to avoid it.
Okay. So like older patients, maybe.
Yeah, 90. Just like you mentioned, was it you or
Yeah.
Sylvia had mentioned
I,
a relative who at 88 who had colon cancer that was cured. So, so in that situation, and you have a family that is now getting serial colonoscopies because of that, and so it may well be that in the future, that could help in deciding whether they had colonoscopy or not. Now, this is another article that talked about mindfulness linked to reduced depression. And of course, anxiety and depression are ever looming large in our society, worsened, of course, by the pandemic. And so it's one of the things that John Robinson made clear to us while he was here was that the treatment of depression and anxiety often is best treated by psychotherapy and mindfulness type treatments rather than medication. And so far, most of the evidence that we're getting is confirming that situation. Although it's easier to prescribe a medication than to have a patient in the office for an hour or so, still appears that is among the best treatments. And mindfulness is now being used as an intervention that may be helpful. Now, as you note, the numbers are too small to really come up with any conclusions, and the follow-up period is too short. But it's food for thought. And what it says to me is that John was right and continues to his knowledge is still utilizable in terms of recognizing that depression and anxiety may well be better treated by psychotherapy than medications. Okay, let's go to the next slide, please. Well, this is an interesting article. It may be misleading because they are not discontinuing the tetanus shot. They're discontinuing a certain type of tetanus shot. There are two types of tetanus vaccines. One is that has only tetanus, and one that has tetanus, diphtheria, and pertussis. And so the one that has everything is being continued. The one that has only the tetanus is being discontinued. Now we know that if you get a tetanus shot, that it lasts for as long as 10 years. But But we're not discontinuing the tetanus shot. It's just that there's a special type of tetanus shot that's being discontinued. And so the need for tetanus vaccine is important. When I went to Africa, the number one infection that was present in the hospital was tetanus. So that you have to get your vaccine because it's a disease that is preventable. So that don't be confused into thinking that the tetanus shot is no longer available. It is. It's just that the single tetanus shot is not available. Now, the issue of tetanus shots is in males, because people who go to the army, almost everybody has tetanus shots. They went to the army. But women sometimes have not had the tetanus shot. And so, so it's important, even more so for women to be sure that they get their tetanus shot vaccine every 10 years or so. Tetanus, otherwise known as lockjaw, is caused by Clostridia and affects the brain and nervous system. And it's lethal. Okay, next slide, please.
Is tetanus more prevalent in Africa because more likely to walk barefoot?
Well, I think it's more prevalent because they don't have a vaccine. But the other reason is, yeah, the reason you gave is a good one. Yeah, they walk bare feet.
Dr. Callender, did I hear you say that everyone should be getting this tetanus shot every 10 years or so?
Yes.
Hmm. I don't
Yes.
Maybe
That's
I
the
missed
recommendation.
something.
That's the recommendation. Yes.
Maybe I missed something, but I wanted to know about how when the adults told us when you step on a nail that's rusty, you have to go get a tetanus shot right away. Is there any truth to that?
Yep. Eminently true.
remember.
Eminently true. Yes, sir. Yeah, because that's a common source of tetanus. And so, yeah, if you do something like that, you need to be sure that you have the tetanus shot.
So is getting a tetanus shot, do you mean your primary physician should ask you every 10 years or on a regular basis about a tetanus shot?
Well, you should have a tetanus vaccine every 10 years. Male or female, yes.
I know I haven't.
And it's uncommon among the women to have it, but you should have it. And if you don't have it, then yes, if you step on a nail or any kind of thing like that, that's important for you to get it checked out. Okay. This is not a surprise to us, but they poll all the countries about happiness and global well-being, and we dropped all the way down to 23, I believe. And a lot of it is because our youth are more unhappy than ever, and of course that's obvious because our youth are killing themselves all the time. Yeah. So the number one places seem to be Sweden and other countries. So why are we so unhappy? Here
Social
our
media.
health system, our social system, our health system is in the 20s, and now our young people are unhappy. And Darryl, what is your suggestion?
Social media is a cause of gloominess with the kids.
Yeah, sad but true. This is an article that emphasizes again that our young people are getting bigger and fatter and having more type 2 diabetes. And we think it's because of the sugary sodas and fruit juices. That's interesting theory. 2/3 of the United States kids consume at least one sugary drink every day. And they somehow believe this is related to type 2 diabetes, which is insulin resistant, meaning that insulin no longer lowers the blood sugar. And if the blood sugar is high, that affects the blood vessels, which gives you arteriosclerosis, which gives you heart disease, gives you strokes and heart attacks. So this is keeping in mind with your children and grandchildren and great-grandchildren, whether they listen to you or not. Now, this is an interesting article. What do you teachers, you teachers agree with this? That 1 in 10 US school-age kids have attention deficit disorder?
I think it's
What
more
are your
than
thoughts?
I think it's more than 1 in 10.
Any other thoughts? A lot of you teachers out there, what are your thoughts?
The teachers have it too.
uh,
I
boys, more than
agree. We have gone to a place where multitasking and it's ridiculous.
so you think this is low? You think 1 in 10 is low or is it high?
Low.
It's low for Black kids, for sure. Even though this says that it's diagnosed more with white kids than Black kids. But I think it's the opposite. Well, I don't know, because I haven't taught that many white kids.
Well, the big issue is diagnosis. It doesn't mean that it doesn't exist. It just is diagnosed. But I share your thoughts. They just aren't diagnosed. That's all.
I know my grandson was put in a special, they have a special class or program now in schools for children with disorders. And I'm wondering if the fact that they have that special class in schools, that the least little thing they see, they put the kids in that class group.
What do you teachers say? What do the rest of your teachers say? We'll let this be the last article. It's already 10:30. I didn't
My
realize.
grandson always thought he didn't need to be in there, but that was a young person and the adults were saying different. But I'm just wondering if the fact that they had to have people in that, so the least little thing that happened, they would put him in that group and keep him in there.
What do the rest of your teachers say? Carol?
Speaking up.
I think I understand what they're doing, but this is coming about. They have cut out recess for children. Children have always been fidgety. There's always that child that we call hyperactive that says sit down no matter from the beginning of ages. And now they got medication to calm down so they can sit there all day long. And that's not a child, like even when I took my granddaughters the other day and they're 10 and 12 to Smithsonian, they ran just for no reason. They wanted to race, they wanted to run. So if you think about them and they're in middle school age, there's no recess, when they get that zest of energy. So they're girls, they can sit there because they used to getting their hair done. But boys, I don't believe in all of this. I really don't. If children have that excess energy, let them run it out. They can think and do much better. China and Japan trying to, particularly when they had such structure in there, they took it all out. They're beginning to put it back in again. I don't think we need to medicate our children because they have all this energy and they can't sit down and stay focused.
Does anyone know Les McCann, the great millionaire motivational speaker Les McCann? He was diagnosed with this, and he's making millions of dollars now.
Yeah, well, my grandson always thought he didn't belong there, and he even said things about the things they did because they were there. You know, you put a whole group of people who may have some type of issue, or just like Carol said, just want to play or just want to run. And so they just did stuff so the teachers, you know, but I just wondered what teachers thought about that track. Yeah.
It's so easy to put a kid in special needs, and that becomes a school to prison pipeline. So it's worth it for parents to hire a psychologist to argue that, to get the kid out of special needs and back into regular class. Kids act up. I mean, it's just human nature. A kid will act out once they realize the teacher doesn't like them, because kids need attention. They need to feel like they're appreciated and liked. And so you have a lot of kids that are acting up just because a teacher doesn't like them.
Yeah. And then you don't know what the kids are going through at home too. So it's a lot. But I just
when they get that burst of energy, they want to stand all day. It's hard for a teacher to teach and half the class is standing. So you take them outside and let them run. Then they started discipline because they had no other alternative to discipline children. So when you go outside recess, you got to stand by the fence during that whole time. And that's supposed to have been punishment for their child. So they couldn't run it out. And if they talked in class, well, you will not have recess today. None of this made sense, but they gave the teachers no choice on how to discipline the kid, because you couldn't hit them again and just say, "Blap, sit down," or something like that, because that's extremely cruel. You know, like a 2-year-old, they're going to do something, you can't hit it. You got to talk to the baby. Now, baby, don't do this. But it's human. We have gotten so intellectual, so they say, that we've forgotten about the basic human needs. And children need to be touched. They need that positive reinforcement, sure, but they need to let out that energy. Now more and more kids are doing drugs just to say, sit down, don't talk. That used to be the most cardinal sin there was. Don't talk. And your most intelligent children are going to talk.
Thank you.
Mhm.
So that did.
But I do know that by the time my grandson got to high school, he was fine to be in with the regular kids. So it's
But then there's another issue. When that came around and they could not classify kids and put them in classes according to their learning ability, which makes it hard for a teacher. You have some children that are slower learners than others. Some children pick up real quick. But there was a law, I forgot the name of the law, that said you could no longer put children in the classes according to their ability to learn. Harvard and Yale does, but a regular public school, you got to have all the children with different learning abilities in one classroom and expect that one teacher to teach them all. The fast learners and you couldn't separate them and say that you're there. Then they start putting them in classes and say you're a special ed and not 11. So it's just our educational system. I hate to say that it's broken. We were trying to meet all the needs, and it's, John, he's on. What was that called when they put you in certain classes according to your learning ability?
Oh, it's tracking.
Tracking became against the laws and rules.
yeah, that's
Tracking
what it was.
works, but then you get in that low tracking, and then they said you'll never get out for the rest of your life, which could be true. But it sure did make it easier for that one teacher teaching all the kids at one time. Because even when you have your own personal children, there's one kid will walk at 2 months and the other child will be 2 years old before they lift one foot up. So, when you have children, they learn at different rates. While all of a sudden everybody has to learn how to read on the same rate. So that's an educational problem that we have. But shooting kids up with drugs so they can sit there all day long and learn, and the test scores still don't go any. So up more, if you're parents, you have experienced it.
Okay, thank you. The article that we had up there was to alert you to the fact that there was a bill in the Senate that was going to defund all medical schools that had DEI programs, which, of course, to me is a backlash against DEI programs. But why would you defund them? I mean, he might do a lot of things. I don't see why you would defund them. But anyway, it's way beyond 1040. So maybe we'll start off the next session with that article. But anyway, thank you all for attending. It's been a great session, and you've discussed things admirably and well as usual.
Thank you very much.
So may you all have a great Good Friday and Easter Sunday.
Yes.
See you next week.
And everybody wish my husband and I a happy 34th wedding anniversary on Easter.
By all means.
Congratulations.
Daryl's
Thank
Daryl's
you.
birthday is March the 31st.
That's my wedding anniversary too.
Oh my goodness. Congratulations,
Easter
Daryl.
Yeah.
Thank you. I'll be 75 years young.
Wow.
Man.
Great.
You
That's
wear
not
it
the way
well.
I taught you. I taught you to say 3/4 of a century.
Okay, I'll be 3/4 of a century's years young.
John, don't listen to John. I hate that saying.
You wear it well. You wear it well, Daryl.
Yes, you do.
Okay.
Congratulations.
See
Thank
you
you.
guys.
Happy
Bye.
Easter, everybody.
Happy Easter.
Thanks for joining us, Lipscomb.
Yeah. You got her muted. She probably doesn't know how to work her computer. I have to teach her a little something.
Oh, yeah, well, she can hear me, Pearl Lipscomb.
Yeah.
Thank you for coming.
Ciao.
Yeah. Ciao. I got to go get ready for this afternoon.
Okay, so does Carol. All right, see y'all.
Yeah.
All right, bye. Congratulations.
Carol.
Thank you
Carol,
for those comments, Dr. Perez, about Dr. Callender. They were right on point.
I don't.
Dr. Perez, if you can, talk to Dr. Callender about having a session where we can discuss how we can get more Dr. Callenders and more Dr. Perez's.
Dr. Callender, absolutely. We should do that.
Very good. Very good.
Look
Carol,
forward to it. Bye.
Bye-bye.
Bye. Carol, am I going to hear the organ this afternoon?
They haven't asked me to do anything, and I'm coming in as a humble servant. I'll do whatever I need to do, but they don't even know I'm coming. So
okay.
I'll find you and I'll